Hey Tess, it's Dr. Roy. This is your case. You wanted me to take another look at it. So this was you today. You had identified that number 9 seems like it's receiving some microtrauma, and you have some periapical periodontitis, acute periapical periodontitis due to microtrauma. It's kind of weird considering it doesn't look like it lines up, but we know in many patients that there's something called crossover that happens at nighttime when our jaw actually goes over to the other side. And basically what happens is the canines disclude the mandible, or they guide the mandible to disclude the rest of the teeth. But once you fall onto the other side of the canines, this tooth can actually smash into this tooth. And sometimes, depending upon the bruxing pattern, that can be a rather abrupt interaction. So you had said number 9 is bothering you. That would be my leading theory on why that is, because it doesn't look like you're occluding there. It looks like this guy's in the way. So neither here nor there. You want to get back on the wagon with Invisalign. So we had your class 2 elastics there, although you're not class 2. We had reason to put that elastic there. That was a previous treatment plan. I'm not sure we need to continue with that depending upon what we decide to do here. So let's go back to where you were. All right, so this is where you started. You're still better now than you were back then. That looks much more profound. But this is where you ended up, at least at the last scan that we had done for the refinement trays. And I don't know how far along we made it. I know you know the answer, but somewhere along this process, your jaw really started to act up, which is why you backed out. But this doesn't look too bad aesthetically. The problem is you still have this interference here. So one of the issues that we have is something called a Bolton discrepancy. So if we come over here, we can see you have a mandibular excess of 1.5 millimeters, which is substantial. So to correct that, we have to take away 1.5 millimeters of enamel on the lower teeth, or create 1.5 millimeters of space on the upper in order to create overjet that is within normal limits. Another option is actually to do some IPR and some space on the top, a combination of the two, which is ultimately what I think we should do. But that's how close you got, but we weren't correcting any of the sagittal situation. As you can see, the molars here and the molars here are relatively the same. I think we can get rid of the button. I think we keep on the existing buttons to give us some additional anchorage without having to place additional buttons. And then we do IPR to close that space. Let me go back to your current status. I don't love the idea of IPR, but the only way to resolve Bolton discrepancies is either to create space on the upper, or create space on the upper and then restore them or leave the space, or remove enamel on the lower. If we look at your aesthetics on the upper, unfortunately, you don't have narrow teeth. There are cases like this where there's a Bolton discrepancy and the patient has more narrow teeth, so creating more space is fine because we can fix that prosthetically. I don't really see where we can actually create more space and not make the teeth look any wider than they actually are. The only place to create space would be on the distal of the canine. That's called the primate space. That has been shown through many studies to be a rather aesthetically acceptable space. With that said, I don't know if that's something you want to do or create. With that said, if we want to minimize IPR on the lower, here are our options. Let's create space on the upper somewhere. When you and I had first talked, we had talked about using not a palate expander. This is important, only because I think the doctors are going to listen to this, if you give me permission to do so. When we expand the palate, we decrease overjet. Expanding the palate transversely decreases overjet. So if we think about maybe a piece of floss that mimics the arch form, if we were to take the floss and push it sideways, what would happen to the floss here? It would come this way. When we expand an arch, we decrease overjet. So we don't have any overjet to work with. So expanding you transversely is not what you need. It would create a bigger problem. But what we could do is expand you sagittally or advance you sagittally and create a space to put a future implant in. That would be an option. We could also do what's called segmental distillation of your molars, where we actually take the molars and push one, another, and create a space that way. There's many different ways to go ahead and create the space, but it's going to require a longer time frame to do so. I actually like that idea the best because it decreases the amount of IPR, or actually eliminates the IPR that we have to do in the front. We can slowly advance the anterior segment to increase the overjet without having any issues. If we wanted to slenderize these teeth to give them more of an aesthetic appearance, we can do that when we increase the overjet. So there's a lot of options. In summary, I don't love the idea of doing IPR on you because you already are missing tooth structure. So your quote-unquote cage in which the tiger fits in, to use a saying out of the book, 6-foot tiger, 3-foot cage, is already too small. So to do IPR on you, I really don't like the idea, and that was really why in the beginning I didn't love the idea. So let me know your thoughts. Do we want to really get you back to where you were? This looks good, but I can tell you, you're still trapped here pretty good. Somebody with your nathologic system, I'm really kind of leery on keeping you here because I think you're still going to be interfering with these front teeth unless we create a lot more overjet than it appears here. So yes, aesthetically you were close. Functionally, I think you were still pretty far away. One of the things I did notice is you do have the aesthetic ability to do the IPR. You have very triangular teeth down here. So to do additional IPR on top of what we may have already done, and I forget, but this message tells me that we did some IPR, you aesthetically can do it without much of an issue. We would want to resolve your crowding first, and I think that was really our plan the first time around. Again, I apologize. I don't remember if we did IPR later on, but due to the severe crowding that you currently have, which looks something like this, that's very difficult to do IPR on. What we would do is we'd do the IPR on this tooth, this tooth, this tooth, and then once these resolve a little bit more, we do the IPR at a later point in time. Again, I don't love the IPR, just letting you know what we can do if we decide to do that. So that's where I'm at with your case. Where you're in discomfort, I have no doubt you want to try to get to the finish line. Like I said, my recommendation will stand that a living orthotic to calm your muscles down before ortho is the way to go. With that said, if you want to take the plunge into the cold water and try to figure this out with Invisalign, let's do it. Just know that we might upset your already sensitive nathologic system. Let me know what you think. I'd be curious to get you back on the path. All right, take care.